Thank you for giving us the opportunity to present our work about the effects of low-intensity pulsed ultrasounds on irradiated bone. So, could LIPUS improve irradiated mandibular bone healing? External radiation therapy is widely used in the treatment of head and neck carcinomas and has several long-term adverse effects. The most threatening one is osteoradionecrosis, which endangers the prognosis of the patient and alters the quality of life. Many treatments have been proposed, from conservative management with antibiotics and specific medication to interruptive mandibular surgery. As LIPUS has shown its ability to improve bone repair after bone fracture, we hereby propose the hypothesis that it could improve irradiated bone healing and thus prevent the occurrence of osteoradionecrosis. We performed several steps. The first one was the validation of a rabbit model of mandibular irradiation. The radiation scheme was chosen after performing a systematic review of the literature and consisted in 5 weekly sessions, delivering 8.5 grays each. Sacrifices were performed from D0 to D42, and samples were analyzed with a microscanner and histology. A modified Paris score was proposed to assess bone healing. This score was adapted from Paris score, which proposed a scale to assess bone and cartilage healing from 1, which is fibrous tissue, to 10, which scores mature bone. The second step was the validation of the LIPUS protocol. Only 3 experimental studies reported the use of LIPUS in irradiated bone, and it seemed quite promising. Our LIPUS protocol consists in 20 sessions of 20 minutes with the same parameters you can see in the table. Sacrifices are performed from D28 to D42, as D0 will be similar for both groups, with or without LIPUS. LIPUS sessions begin immediately after the completion of radiotherapy. Our radiation scheme seems to delay bone healing with a significant decrease of bone mineral density, of the ratio bone volume on trabecular volume, of the trabecular number, and an increase of trabecular spacing. Moreover, we found a strong correlation between imaging and our modified Paris score. We are currently performing the last sessions of LIPUS. Preliminary results seem to show a greater heterogeneity in irradiated bone healing with LIPUS. They seem to increase trabecular number, decrease pain, and increase food intake. At D28, the difference between the irradiated group and the group with irradiation and LIPUS seems more important. Bone mineral density seems to be slightly increased, as well as the ratio BV on TV and the trabecular number, as you can see in the table. It looks as if LIPUS could influence early stages of bone healing, as the differences are more important at D28. Due to the small number of samples, we cannot yet determine whether these results are significant or not. The study goes on, and more samples will be analyzed, but the preliminary result seems promising, and we could lead to clinical application if they are consolidated. We thank you for your attention, and we also thank the FUS Foundation and the IFRO for their support.